released approximately 70 pages of detailed health information. It's the Edmonton Zone Performance Dashboard and includes key measurements on ER wait times, continuing care, surgeries, children mental health, radiation therapy, among others. It's incredibly important information. But none of that is readily available to the public. We went through a costly FOIP process taking months just so HS could release data about the state of public health to the public. To the Minister of Health, why do you refuse to proactively and publicly report this important information about our healthcare system?
Thank you. Honourable Minister of Health.
Well, Mr. Speaker, perhaps what the honourable member should explain is why she would want to spend good money to buy outdated information from Alberta Health Services that doesn't tell the story today about the tremendous performance of our healthcare system. Mr. Speaker, this honourable member knows that AHS publishes a performance report available on their website which compares the performance of our health system to other provinces and territories, usually using nationally recognized benchmarks. This, Mr. Speaker, reflects the everyday experience of citizens in their healthcare system. It provides them with accurate comparisons. It's the right way to proceed, Mr. Speaker, and it's what we're doing.
Thank you for supplemental.
Well, Mr. Speaker, let me just say this to the Minister, if I may. We'd have more up-to-date information if he let the FOIP go through and give it to us immediately. Given that less than a year ago, Alberta Health Services did report comprehensive system performances by zone on a regular basis, why are you now leaving it up to the opposition to take and publish this information? Minister, it's about accountability.
Mr. Speaker, it's about ethics and ethical behaviour. If I just heard this honourable member correctly, she suggested to this House that I interfered with the release of information that she had requested under the FOIP Act. I certainly hope that's not the case, Mr. Speaker. What I will say is that we have developed a performance measurement system that reflects all of the nationally accepted indicators reported by the Canadian Institute for Health Information. It will be broken down by zone, Mr. Speaker, in the next iteration. It's a good snapshot of the very good performance that our health system is delivering and the workers that support it.
Thank you. Final supplemental.
Well, Minister, maybe you'd like to answer this, and this is from a CBC document. The memo shows Johnson and Minister had direct access to the AHS records 2 months before they were to be released. Under the FOIP Act, documents are to be released within 30 days, which means an extension appears to have been taken by Alberta Health Services to facilitate Johnson's vetting of the records. Yes, maybe you'd like to respond to that.
Well, Mr. Speaker, this honourable member doesn't seem to know when to stop. I haven't seen the email that she's referred to, Mr. Speaker. But if she is accusing me in this House, Mr. Speaker, of interfering with the release of information under the Freedom of Information and Privacy Protection Act, then she should say so. Otherwise, Mr. Speaker, she should educate herself on the provisions of that Act and the responsibilities of ministers to ensure their departments comply with that legislation.